Why do you think the Ukrainian charity clinic is needed?
Before I start there, Bros, I'm going to say my name is Dr. Greg Wolfus, and I work at Tufts at Tech Community Veterinary Clinic. I work at the Cummings School of Veterinary Medicine at Tufts University, and we've created a community teaching clinic here about 12 years ago.
Why do you think the Ukrainian charity clinic is needed?
I think it's so critical with the recent devastation that's happened in Ukraine that we not only have a place where people can get care for their animals, but also a place where students and veterinary professionals can learn how to care for those animals.
What are the main tasks of the charity clinic?
The main task of the charity clinic would be to handle basic veterinary care needs for the underserved pet population. Specifically, we need things like vaccinations, microchipping, spays, and neuters. But additionally, a charity clinic can handle many of the atrocities we see during the times of war, including wound care, potential amputation, ocular care if there's a corneal ulcer, these types of things. So basic animal needs.
What services will the charity clinic provide?
The primary services that the charity clinic are going to provide include basic vaccination, spay, neuter, microchipping, ophthalmic surgery, but most importantly, because of the war, there are many animals that have been neglected that may have wounds, skin problems, may need a toe amputated, nail trim, these types of basic services, along with whatever surgical procedures are comfortable in that environment.
What departments are most important to have in a charity clinic?
So the most important thing in a charity clinic is to have a general practitioner, a clinician who does all basic veterinary care, and then specifically somebody that's comfortable with dermatology, something that's comfortable with eye problems, someone that's comfortable with basic surgical handling skills. In addition, services, it could be dermatologists, it could be surgeons, eventually it could be dentists, stomatologists, those types of people. I think as far as space, these charity clinics really should be 3 exam rooms so that you can have a good flow of patients. They absolutely need to have an operating theater where procedures can be done, and they also need enough space to both have multiple people in the room for training, but also have enough basic equipment to meet those basic needs.
What do you think in Tufts at Tech can be work as an example for the Ukrainian charity clinic?
Absolutely. Unfortunately, in the last 12 years, I have had the blessing of helping many different schools in the US, but also internationally, create community or charity clinics whereby they find out what is most needed in their environment. We provide those services while at the same time teaching veterinary professionals how to provide those services in those environments so that we have sustainable programming. Ukraine, unfortunately, the tragedies that have happened there have left a gap in accessible care. If people cannot get care for their animals, or people are busy fighting in the war, we don't have anyone to take care of the animals. So we need to train people. Another thing that's critical to discuss is how we start these programs. In addition to having veterinarians and people who are passionate and mission driven, we also need the students and we also need the community. But third and fourthly, we also need money. And I think it's really important for everyone to understand that without the donors who are there to help the Ukraine Charity Clinic, or without the donors to help create Tufts at Tech, none of this would be possible. So one of my former clients before I started Tufts at Tech was a beautiful woman named Janice Kalkin. Janice Kalkin has now passed away, but before she passed away, she gave $250,000 US to start this clinic and continued giving us money throughout. And after Janice left, she paid significant money to endow my salary, partially, which is really necessary for these charity clinics to work. If we don't have enough people sharing the message and buying the equipment, then we can't do the good work.
What departments are most important to have in a charity clinic?
So the most important thing is to make sure that we have an exam room. I speak in square feet, but 100 square feet or 10 feet by 10 feet is what this exam room is, in order to have a table so that we can examine the patient. Oftentimes they come with multiple people, so having a couple chairs for the people to sit in, and really basic supplies. We're blessed to have an electronic medical record system, so each one of our rooms does have a computer and a telephone. But if somebody doesn't have an electronic medical record system, those things are not necessary in the exam room. So additionally, in our charity clinics, it's critical that we have basic microscope. We also have an incubator for checking urine cultures, and then quick dyes for basic cytology, ear cytology, and skin staining, along with some fine needle aspirates if there's a mass or something else going on. But very, very basic equipment. You can see we have a couple microscopes. We do fecal exams and we do cytology. And I'll just mention, this is basic pharmacy. This is our entire pharmacy here, minus heartworm and flea and tick prevention, which is in the other room. Many of these products are donated generic pharmaceuticals. So building relationships with all the pharmaceutical companies in Europe is critical to try and get these products either free or as low cost as possible, so that we can provide them to our patients who don't have the money to afford them. So this is our main treatment space, and what I want you guys to see is it's important that these spaces have enough square footage so that you can see everything that's going on. Over here, I'm just going to point out, visiting student from Ross University, vet student, visiting veterinarian from New Zealand, vet student, high school student, veterinary technician, veterinary student, veterinary intern, veterinary technician specialized in dentistry, veterinary assistant who is one of our former high school students. In the back we have a fourth-year veterinary student from Ross, another fourth-year veterinary student from Tufts, and a visiting intern, college intern from Assumption. As far as that animal is here for a dental procedure to have teeth cleaned and extracted. Over here we have a cat spay and a cat neuter, and those are going to happen, come this way, in the surgical operating theater. The students set up their trays to prepare for their surgery. And then this is again, it does not have to be big. If you look around, this is about 12 feet by 8 feet, which is 100 square feet. We have anesthetic machines, we have appropriate monitoring, we have fluid pumps, we have the ability to heat the animals while they're under anesthesia so they stay warm. Another heating device, instruments, cupboards and storage for surgical instruments. We do have cautery for complicated surgeries. And then behind you we have surgery, suture, suction, ability to check blood pressure and monitor end-tidal CO2. The other thing that's really, really important, having a good surgical light is necessary to see what we're doing. So even in places where there's limited resources, you can't do surgery without light. In this situation, we have, I think you guys are placing catheters, right? So there's one student is gently restraining the animal while the other student is placing an IV catheter. Once the IV catheter is placed, they're then going to use induction agents like propofol in order to sedate the animal, intubate the animal, and then proceed with the dental procedure. Very little space here. This is not an ideal space for a dental procedure. This is an old cadaver table that we've modified to be a wet table for dentistry. In our next clinic, we will have 2 dental tables side by side so that we can handle a higher caseload. But these students are doing it all. They have a digital dental x-ray machine. Well, it's not, it's right here. Oh, I'll show you. This is called a Nomad, and this is how the bros take their x-rays. and we'll come back and have you guys during that phase show you. I gotta be honest with you guys, I don't do technology, so I don't know what's going on here. So this is, do you know what a blooper is? This is a blooper, dude. I don't know how to put this together, dude.
Why do you touch my stuff?
I touched it, dude. I'm putting it back.
Why do you touch my stuff?
I'm sorry, I touched it. You don't be in charge of things. No one's in charge. Okay, dude, give me a pew pew. Pew pew pew. Like so. Cool? And then on an x-ray plate that goes onto that computer, here's a digital x-ray sensor. And once this animal is down, they're going to chart its pathology, and then they're going to take x-rays and diagnose and then extract. This is radiology. As far as radiology, depending on the community clinic and the size and the amount of surgeries and procedures that they're doing, will define whether or not this is an affordable option for the Ukraine charity clinics. In this clinic, this costs about $100,000 US for this DR or direct radiology unit. It plugs into this computer and the images pop up automatically, and then we can send them to a PACS server if we wanted to have a radiologist review them. Most of our time we don't need a radiologist to review them because they're pretty basic. Additionally, if you don't have the ability to buy this big machine, using that Nomad digital x-ray, which costs about $10,000 in order to take radiographs of small animals' feet and toes, or rabbits or other small birds, that can be really helpful. Another tool that can be really helpful but isn't necessary is ultrasound machines. We do have 2 ultrasound machines. We do a lot of what we call POCUS care, which is point of care ultrasound. In that situation, looking specifically, do we have heart failure? Is there fluid around the lungs? Do we have bladder stones? Is there evidence of kidney disease? Just very focused ultrasounds. These tools, you can buy various ones that are much smaller and less expensive. And then there are some that are $250,000 US. These ones are about $30,000-$40,000 US. But they really, really are helpful during the education process, because somebody can feel what they're feeling. Someone can take an x-ray and see what you're seeing, or you can 3-dimensionally look at an organ with ultrasound. So there are pluses. And you'll see we have storage problems. Like everything is a storage closet in a charity clinic. So this is all of our storage material for bandages and casting and splinting, all of the things which I think should be able to be done at the Ukrainian charity clinic.
How many employers do you need for the charity clinic?
So having one doctor alone is a very big risk, because if they get sick or they have a problem, then the entire clinic stops. And we started with one, but I very quickly felt it was necessary to have 1.5 or 2 doctors minimum. If you have 2 doctors, I really would suggest having 3 to 4 staff members. That way you can keep those exam rooms flowing. Here at Tufts at Tech, at this point in time, we've grown. We have 4 veterinary doctors. We have 12 veterinary students. We have 12 high school students, and we have 7 staff members, technicians, receptionists, those types of people, is our current model. But this model has grown. We're seeing about 3 to 4 times as many cases as when we started. And when you guys start these charity clinics, they'll start, but then once those people know they can come, very quickly you have more services needed. These are our cages. Again, you need to store animals at some point in time. Our space for today, our top shelf, and this fellow down here, he's getting sedated for x-rays. That's the animal that is having the dental procedure. So you can see we've got 5 cages here at Tufts at Tech, and they're usually maxed out. Like in our next space, I will have more cages, and if I was choosing for you guys, I would start out with 8.
Why do you want to be involved in this project, and what is your main hopes for this project in Ukraine?
So the main reason I want to be involved is because we're all human. And I live in America, I was born in America, but my ancestors are from Uman, Ukraine. My grandpa's from Uman, my grandma on the other side is from, oh Christ, I'm drawing a blank right now. Uman. And there's another one that's Odessa. My grandma's from Odessa. In any case, my family moved for persecution reasons and went to Argentina before coming to America. And I see the same thing happening now with different fights over land and different things. And it is not okay for humans to ever accept this type of violence. And we all need to support each other to fight violence. So that being said, as far as the Ukrainian charity clinics, now I have this job where I create community or charity clinics that are teaching clinics. And I have the blessing that I've been able to do this in different parts around the world. The minute I see tragedy happening in Ukraine and the minute I meet Vlad and Natalia is the moment that I know that I need to do something to help the people, the animals, and the veterinary profession in Ukraine. And my only hope is that we can not only help the animals and make the world see the horror that's happening, but also help prepare all of the future professionals to be able to handle what comes their way.